Good afternoon. Thanks for the invitation to this web seminar. This case presentation is about an 18-month-old boy who lives with his parents in a rural location. The nearest hospital is 200 kilometers away from his home. As important backgrounds, he was delivered at 36 weeks of gestation through an emergency cesarean. Neonatal sepsis by pneumonia and pulmonary dysplasia were diagnosed at the neonatal period. He left the hospital 10 years later, but he came back after fever, stupor, and dyspnea were appeared. So he was spent almost 12 months in the hospital. Central venous catheter were placed 11 times. 17 surgeries were performed. A laparotomy with appendicectomy included because he presented infection and malfunction of the ventriculoperitoneal shunt. However, he developed peritonitis. He came back several times to the hospital with infection and hydrocephalus, but sometimes he had only hydrocephalus or he had only infection. The last time he came back with hydrocephalus. I met this little boy last year during my pediatric academic rotation. He was in the hospital 23 days before my arrival, and he had an external ventricular drain. He developed ventriculitis, malnutrition, psychomotor retardation, endocarditis, and cardiomyopathy with high blood pressure. I surprised with the clinical exploration because he looks like a normal baby, but his head circumference was under 5th percentile. The anterior fontanelle was closed. He could move his body, but he couldn't walk, sit, or control his head. The pediatric medical team obtained a lot of positive cultures. Staphylococcus epidermidis was the most common bacteria. Infections in another referent compartments to the ventricular system had a good course with antibiotics. The following images shows the change in the ventricular system. And this is the first tomography before all surgeries, and this is the last tomography when I met the little boy. You can see the loculated hydrocephalus. So the first treatment proposed by us was an endoscopy with ventriculostomy, septostomy, and choroid plexus coagulation. But in that hospital, we had to face many challenges. There was no tomography, magnetic resonance, or endoscope. The parents couldn't pay many studies or surgical items, and because of his poor prognosis, we could not to refer him to another hospital. It was impossible to work with the peritoneum. Another ventricular shunt was so risky. There was stenosis of jugular veins, and the pleural cavity was not a good option. Remember pulmonary dysplasia and urinary tract infections. So we are going to answer the next question, the following questions. This is the first one. This is the second question. And this is the last question. Thank you very much. We are going to continue with the presentation. So after negative cultures, the next surgery was a ventriculovascular shunt with the left jugular vein. However, 3 days later, he developed a cerebrospinal fluid leak, and we extravasate the distal catheter and we wait for negative cultures. 2 additional external ventricular drains were inserted, and we proposed to the boy's parents the last option, with a high risk of failure and high monetary cost. They made an extraordinary effort to pay the endoscope renting, but we couldn't see anatomical structures of the ventricular system because there were many membranes. We tried to clean the ventricular system, and finally we placed an external ventricular drain, and we indicate acetazolamide. We sent the boy and his family to palliative care. But the clinical evolution was good. We removed the external ventricular drain after 3 days, and the boy didn't develop intracranial hypertension again. He completed 53 days with antibiotics, and finally he left the hospital. Now he is 3 years old. His last tomography and this video are from 7 days ago. You can see the psychomotor retardation persists, and he presents seizures 3 times after the last surgery. Thank you so much. We are going to continue with the discussion.